Aloha, good morning, everyone. Thank you so much for joining us here on the COVID-19 care conversation on the platform of the Honolulu Star Advertiser. This is a conversation that is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. And today, Ryan, we've got a great guest to talk to us about a myriad of issues, all centered around kids.
That's right. We have Dr. Jennifer King, a pediatric sports medicine physician from Hawaii Pacific Health, who will be joining us today. It's sort of our Ask the Doctor Wednesdays, where we like to catch up with some of the doctors and hear about some of the things that are happening in the community. We know that this COVID-19 has impacted a wide variety of services in the medical community, not just specifically to COVID-19, but has really transformed the way in which medicine is being practiced, especially for young kids as well. So we want to hear an update from her about some of the things that they're doing to help to see patients, to help service children, as well as get some updates on their efforts in Hawaii Pacific Health's efforts overall with the pandemic. So looking forward to talking to her. Encourage all of you to insert your comments. If you have any comments for the doctor, we'll be getting to her in just a little bit. But first, again, we'd like to start off our show with our daily count from the day before.
Yeah, and it's looking really good. Just one new case across the islands for a total of 641 cases since the pandemic began. We've had single digits since April 18th, which is amazing. If you look at our rates compared to those of other states, we are really doing well. Hawaii's staying constant with 17 deaths since the pandemic began. So again, no new deaths to report. So we've not exceeded, I'm looking at our statistics here, 4 new cases per day for the last month. So we're doing really well in flattening that curve. That said, people are starting to get out more, including kids. And that's also why we've invited the doctor to come on today to talk about how we can safely engage our keiki in the community. You know, children over 5 are required to wear a mask when they enter businesses, but how do we safely engage them in play? How can they, again, start to interact with each other? We're going to be talking to her about all of that. Joining us now is Dr. King. Thank you so much for being here. First off, tell us about the kinds of precautions that you would recommend to parents as they do start to re-engage their kids with other kids.
So for sure, it's been a lot easier to get kids active. That was the biggest struggle when everyone was at home. So people were trying to be creative. Some of the schools had done online PE because we know kids need that activity level, not only to decrease stress, but also to learn if they're still doing distance learning. Now that the parks and beaches are open, we do want to get the kids out, but we want to make sure we still practice, distancing from other people. So just that physical distancing that we've been recommending. And also just to keep in mind that, we have to be cognizant of water safety and also what I call wheel safety. So anytime kids are on any device that has a wheel, if it's not a car, they need to have a helmet on. And then as far as the water safety, just to kind of make sure there's an adult supervision for them.
We actually saw numbers, and we hear it from EMS officials. We've heard it from other doctors that we've spoken to, that overall cases have sort of gone down because people have been contained and have been confined to their home. Have you seen that with numbers, obviously, with injuries to children or sort of things that come through your office on a daily basis? Have you seen that drop and potentially picking up again as things reopen?
We think that the more sports-related injuries will start to pick up even as kids start to condition. And we are trying to be careful to educate the coaches to remind them that these kids haven't really done anything in a long time. So we just don't want them to get injured getting back to sports too quickly or sports-like activities. As far as the fractures, they've been fairly steady. I think kids get super creative when they're at home. So whether they're trying to replicate American Ninja Warriors or different kind of obstacle courses, we've actually still seen fractures and have been bringing them into the office.
Let's talk about that in office versus not in office. We know that a lot of people have been reluctant to go to see a doctor in person. How are you incorporating telemedicine in your practice? When I think about your kind of relationship with patients, it seems to me like the kind of practice where you'd actually need to see someone. So how does telemedicine work when you're dealing with sports injuries, especially with kids?
It's so interesting how the past 2 months have gone. So we did start off with 50-50 phone calls versus in-person visits, mostly because we didn't have the technology to do the telemedicine for all of our docs. As IT has kind of ramped up and gotten us on televideo, for the period of time when the state was really shut down, we were about 80% telemedicine and about 20% face-to-face. So for sure, a lot of the follow-up visits we can do via telemedicine. Some of the fractures that don't require a cast, so if they just need either buddy taping or a sling, then often we'll do them remotely. We actually send them to x-ray centers within HPH that aren't tied to a hospital. They get their x-rays done, and then we can screen share the x-rays with the parents and make recommendations for what activities are safe.
What kind of efforts are you folks taking for those patients that are maybe not going through telemedicine, are still coming in? I've got to imagine that you folks have sort of adjusted the overall protocol for seeing patients now with these social distancing measures that have been implemented.
We have. So we actually limited how many providers are in the office at any given time. We removed waiting room chairs so that everyone is 6 feet apart. And so it's typically a parent and a child only that will come to the visit. Our entire staff is wearing masks. Everyone is social distancing. And then we make sure that we really ramp up how well we clean. So we're cleaning between each visit as well.
There's a question coming in from Cheryl Sutsumi who's saying, have we seen any cases here of the COVID-19 related illness that's affecting children on the mainland? I know a lot of parents are concerned about what we're hearing, these rare but very serious COVID related illnesses, or what appear to be COVID related.
Yes, we have been very lucky here. We have not seen any of those children affected in our state. Of course, our radar is pretty high, and our hospitalists are working hard to kind of make sure they keep an eye on any of the kids that have chronic illnesses and things like that. But luckily, so far, we have not had any cases.
The other question that we had is about just overall, you spoke about athletics and getting kids back into the groove of things. Obviously, another thing that a lot of kids and students are looking forward to is participating, hopefully, in high school athletics with the fall season coming up. And we know that you sort of serve on that board as well. Is there any update that you can provide of some of the measures that are being taken in order to maybe see these students return to their playing fields and courts come in fall time?
Right. So there's been so much information from a lot of organizations. So the Aspen Institute for Play and the IOC and the NCAA have all started to put forth some data about their recommendations. So most of it is phased, just like everything else has been with regards to opening up the state and things like that. And initially for the team sports, a lot of it is just small groups, still doing the physical distancing, kind of maintaining, good practices as far as masks when you can, and when you're not within 6 feet and you're working out, you can take a mask off, making sure they're cleaning equipment, limiting equipment, making sure that you ask the same questions you get asked every time you go to a medical facility with regards to the coaches, athletic trainers, and the athletes. The individual sports are a little bit easier. So when we talk about things like bowling and air riflery, singles tennis, those are a lot easier to ramp up to what we normally see in those sports. But team sports like football is going to take a little bit of creativity and a lot of education for the coaches and the athletes.
What are your biggest concerns with those team sports? I mean, I'm just thinking about football, as you said, or a sport like basketball where people are very close together. I know that, we've heard that singing, for instance, in a choir should be limited because of the droplets that are dispersed. I can only imagine in a huddle, a coach, shouting plays or instructions. Like, how is that actually going to work?
It's going to take a lot of culture change. So even with some of the recommendations that have come in, they're like, no more high fives, no more fist bumps, which is going to be really, really hard because that's kind of integrated into their culture. I think that it's going to look different until we either have a vaccine or have enough immunity in the community. And so it's just going to take a lot of just awareness, and education is going to be really key for those team sports.
Another thing, of course, that children are looking forward to, as you mentioned earlier, just kind of getting outside and being able to, once again, to get on the beaches and to be able to participate in sort of those activities. But what are some of the things that you folks are doing to help to educate the public about some of the safety efforts? I know that you said to wear helmets and beat safety and things like that, but is there anything specifically that you folks are recommending, or things that children should always, or parents should be aware of when these children sort of kind of get out there once again and are excited just to be out in the beaches and the waters again?
Yeah, so I think a lot of it is just kind of remembering what it's like when your children were very little and you were pretty careful about what they were doing in their surroundings. So getting especially young children back, just the same things you would have done when they first started to go to the playground or go to the beach, is just really keeping an eye on them and making sure that they're practicing physical distancing, which is a little bit different than baseline, but making sure that they're doing that. And then that they're not doing anything extraordinary that they normally wouldn't do, right? So I wouldn't expect a child that have never been on a skateboard before to get cut loose to kind of go down a set of rails or anything like that. So just to make sure that they're kind of doing things within their age limitations and that someone's keeping an eye on them as well.
You know, it's really tough. I have a 1-year-old and a 3-year-old, and I'm just thinking about when we start to get back to parks. My daughter's going to want to run up and play with other kids. What kind of conversations have you suggested for parents? Because you don't want your child to suddenly not be friendly, but how do you direct parents on how to direct their kids when it comes to group play?
Right. Some of it's difficult when it's younger kids just because they just don't have the capacity to understand. So sometimes with the younger ones, we'll just kind of talk about right now we're being very, very clean. So we're not playing with other kids except, brothers and sisters or anyone else that lives in your household. One day again, we'll be playing with everybody. But for now, if we want to play outside, then we just have to play with our brothers and sisters. So that sometimes is good for the younger kids. The older kids, they usually have a little bit more capacity to understand. So if we're talking about, right now, if we want to go outside, the rules are you have to stay within this distance, right? So sometimes it's easier if you say, okay, stick your arms out. 3 of those arms, no one should be in that space around you unless you live with them at home. So sometimes using something more, more that they can see, not just saying, 6 feet of distance, because most kids don't know what 6 feet is. But if you just relate it to a body part, they're usually better to understand it.
Sorry, go ahead.
Well, okay. I know that you see a lot of parents and children, and I know that this is a little bit outside maybe your scope, but I'm interested in the whole mental health piece of this. You must see a lot of parents who are particularly stressed right now and how that's affecting kids. Can you talk a little bit about the mental health aspect of the virus and what you're seeing?
Sure. So there's a couple of points to that. So one is for very young kids, they are complete parent radars. So they know when parents are stressed and parents are worried, and they tend to internalize it and not really show it. So a lot of it is just having moments of time that you're just either doing one-on-one or family time with them, just to keep them connected and engaged in the family. For the older kids, when they're supposed to be in school and they're not, I find that it's been one of two things, because I usually do a check-in with my patients. Even though I do sports medicine, everything is connected. So I want to know where they are mentally. And so some kids that are either introverts or tend to have some issues socially at school, they love distance learning. They think it's the greatest thing in the world, and they're glad to be home and away from those stressors. And there's other kids that are very social, very extroverted, and they miss their friends a lot, and it's really hard for them. So trying to keep them connected. We know that virtual is not the same as being in person. There's a lot to be said for hanging out with your friends, but to even just to have them do, either their, house party kind of visits or anything like that is really important. The key for any age group, the ones I can tell you, is to just ask them how they're feeling. And then sometimes they are able to verbalize it. If they're not, then you look for signs like, is their appetite changing? Is their sleep changing? Are they not kind of keeping up appearances to some degree? We know that we don't expect everyone to get dressed up like they normally would, but, have any of those things changed? Is their mood a lot different than their baseline? So those are the key things to look out for.
One of the things, of course, that has had to change, and we talked about telemedicine a little bit earlier, but, are you folks, I guess, what would be the process, or what would you recommend to a parent that potentially wants to bring their child in for care? Would you recommend the telehealth route first, or should they be coming in to a facility? We do have a question here. I believe she's referring to Kapiolani, but do you think it's safe for my medically fragile child to resume treatment at Kapiolani, or is telehealth maybe the first option and then sort of going down the list? What would you recommend?
So For sure, for the medically fragile kids, I would recommend telehealth as a first option because we can do a lot of triaging via telehealth. And if we feel that there is a need to come in, then we can always get that arranged. And oftentimes, especially with those kids, we'll try to be really careful and not have them wait in a large waiting area. So, for instance, they could wait in their car until it's time for them to actually come into an exam room so they're not in a large open area with other people. Though things that are pretty obvious, like if they fall and their arm looks deformed, or, for the grandparents that are having chest pain, like those, I would definitely go to the medical facility to seek care because those are more urgent issues. But if it's something that you normally would not take them to the emergency room for, I would first contact either your doc, if you know them, the subspecialty docs, or your primary care provider, and they can initiate either a televisit to start off, and then if needed, can bring you in from there.
As we start to get more active with our kids, a lot of parents may not have that kind of background. They haven't necessarily done that. What is the best way, do you think, for parents to engage their children when it comes to just staying active and healthy together as a family?
Are you talking with regards to things to do with them at home?
In and out of the house, now that we're allowed to go out a little bit.
Right. So, with the younger kids especially, we just want them to move around and play. And we don't necessarily need them to do anything that's super organized. So even like in the house, like just doing dance parties, just putting some music on and letting the kids, dance around is totally awesome. Also, we've been pretty creative. We've done a lot of like plastic cup golfing at home. So we'll set up these cups sideways and just have them hit them. And we don't have a golf club, so we use a hockey stick. So, different things that you can utilize around the home and just being super creative. My son went through a ping pong phase, so we have a lot of ping pong balls. So setting up cups around the house and seeing how many times they can get the balls in. You can do what I call like horse hopscotch, where you do a hopscotch pattern and everyone has to do the same pattern. So there's lots of different things that you can do. And sometimes it's being creative. If you don't like being creative and you're really stuck and you have access to the internet, Pinterest is another really good site. Indoor activities for kids or outdoor activities for kids is always, good for resources too.
Yunji's over here taking notes for.
I am, yeah. Well, my daughter's almost 4, and we are doing quite a few dance parties because the organized play doesn't always work, but they can always move.
Yeah, the moving is key, and I think we've seen a lot more complaints of back pain and hip pain in adolescents because they're sitting a lot more than they normally would, and they just don't realize it, right? So typically in a perfect world, if they're still doing distance learning, you want them 30 minutes doing work, then 30 minutes moving around. Sometimes that's not feasible because some of the schools do front load a lot of the synchronous work. But, if even every 20 minutes, they can just look away from the screen for 20 seconds and take a little bit of a breather, it's really helpful. And then whenever they get a break, they actually need to get up and do a lap around the house. And that is really helpful as far as offsetting the back pain and the hip pain that you get from sitting all day.
Yeah, I hadn't even thought of that. We're turning our kids into office workers.
Yeah.
And at least in a classroom or in a school setting, they have to walk to their next class.
Exactly.
And the 20 seconds looking away from the screen is great advice, not only for kids. I think it's great for adults as well. We could get glued in to our screens.
Yes. And it's funny. One of our administrators the other day, she said, I got up and went for a walk and it was the best day I had because everyone's used to just sitting in front of a screen now and doing a lot of the work. So we just have to remember our bodies are made to move. They're not made to sit in one position.
Well, Dr. Jennifer King, thank you so much for taking time to join us today. Great conversation. We would love for you to hear from you again, maybe in a few weeks, get an update. Of course, we know that you're actively involved with the high school sports, so maybe an update as some of those things come back, and maybe an update more when we see more kids being able to go out and be active. But thank you once again, Jennifer King from Hawaii Pacific Health. Thank you so much for joining us this morning.
Thank you so much. You guys have a good day.
You too. Aloha.
You too. Very interesting to hear from her. And I really hadn't thought about adolescents having back pain from sitting too long. But wonderful to hear.
Here.
Yeah, exactly. Wonderful to hear her advice and to know that telemedicine is something that is available, even in that kind of a practice where you think that she'd need to be there actually examining fingers and toes, but no, she can do it through a computer and that it can be as effective. So that's great to see.
Yeah, pretty incredible how far telemedicine has come, especially in these past few months, even, and the involvement of that and being able to treat some of these patients, especially kids. And I also thought some great advice out there, for parents that are beginning to let their kids go out and do more. Also, she's saying that kids still find ways to get hurt, no matter if they're at home. There's still ways, and they're still treating some of those fractures by kids that are trying to reenact maybe some of these things on television. So great to hear from her and get an update from the different perspective of a doctor dealing with some of the evolution of COVID-19 here in Hawaii.
Yeah, and on that same topic, of course, we also like to talk about a few headlines in the news today. There's a great article in the paper explaining how the city and county of Honolulu is planning to ramp up coronavirus testing to over 100,000 tests. The city is partnering with the John A. Burns School of Medicine to deliver those tests, and it's going to be a program of several different kinds of testing. They're going to be doing cotton swab and antibody testing, along with wastewater epidemiology. So that will be very interesting. They can actually test the wastewater for levels of COVID to see if there are certain communities, and then kind of work backwards, if you will.
Yeah, and it's really not necessarily a gauge that's going to pinpoint an area or really try to specifically find someone, obviously, in the wastewater plant. But it's a good gauge to see just the overall community spread that may be happening, and a way for the city to track it that way. And of course, by involving the John A. Burns School of Medicine, excuse me. They are really being able to work directly with some of these doctors and these researchers who really make this their living, and being able to involve them, I think is a great partnership that a lot of people are looking forward to. We'll see how this sort of plans out, and seeing how the testing sort of unveils itself in the coming weeks.
Yeah, and on that same topic, tomorrow we do have Dr. Sarah Park joining us. She is the state epidemiologist, so it'll be interesting to get her thoughts on this kind of testing. Testing is so important to containing the spread of the virus, and so we'll be talking to her about antibody testing, active virus testing, and also about contact tracing. Those are three sort of buzzwords. What are the state's plans when it comes to contact tracing? And as we start to open up more of our community, more businesses, retail, gyms, potentially hair salons, and what have you, how testing is going to interact with all of that. So we really look forward to that conversation.
Yeah, and we encourage all of you who may be watching out there to definitely insert your questions for Dr. Sarah Park. We know that there are some conflicting reports of what the Department of Health is recommending and doing, and what some state and city officials want the state to do. And so we kind of want to get more clarity on sort of the Department of Health's path moving forward as the state begins to reopen, what they're doing, and also just kind of hearing what other states are doing and what other countries are doing. We're hearing some other reports of the way in which testing and implementation is happening throughout the world, and how closely Hawaii is monitoring that. There was a great report that ABC News actually reported on from Greece, and how they were able to keep their levels down, and some of the efforts that they're doing to really monitor the tracing of that. So those types of questions would be great to ask Dr. Sarah Park. And again, we encourage you to tune in tomorrow to ask her those questions. Other headlines that are making news, of course, the state legislature still continues to be in session. And one of the things that the state lawmakers are planning to do is stash more than $1.6 billion in sort of the rainy day fund, to reserve that for the potential effects of this pandemic. Some lawmakers recognizing that this is something that will last beyond just the immediate few months or even this year, and looking towards the next legislative session, where jobs will continue to need to be maintained, as well as programs and services. And so their thought is to sort of take some of that CARES Act money and some of the tax revenue, and inserting that $1.6 billion into the rainy day fund. There are some who oppose this idea, including Senator Laura Phelan, who has been vocal about her thoughts about trying to make sure that money gets out to the people and to the community right now. She does not agree that the money should be put into this fund, and rather she thinks that it should be spent now on the services that need it the most. So for more, we encourage you to head over to the paper to read that article today.
Yeah, very interesting argument that's happening. Do we spend the money now? Do we save it for later? Because we know that we are going to be facing some major financial hurdles in the months to come. So we encourage you to read that. On a happy note, we always like to highlight a Hawaii hero. And, since school buses are no longer filled with students, a local nonprofit organization has an idea to repurpose those buses. The organization is Hawaii Kids Can. They want to roll out Wi-Fi on wheels in Hawaii. The project would use school buses that aren't in use and turn them into Wi-Fi hotspots so that kids and families have access to online learning, telehealth, and other social resources. So you can learn more about this program, how to help with it, or how to get involved at hawaiikidscan.org. I actually checked out that website as a parent. It's very cool. They have all kinds of resources for parents, including information on food distribution, links to educational resources, links to mental health resources, and then a lot of resources there for educators as well. But great idea to use the buses to turn them into Wi-Fi hotspots. In the past, libraries have served that function as well, but the libraries aren't open right now, and a lot of families don't have access to high-speed internet, and so that's been limiting their ability to do distance learning. So this is a great way to connect communities to the resources that they need.
Yeah, we heard Superintendent Kishimoto speak about some of these efforts that the state is doing last week when we spoke to her about getting these Wi-Fi hotspots out into the community. And so great to see how people are and organizations are being innovative with trying to find needs and trying to fill those needs with things that are available like buses. So we thank them, our Hawaii Hero of the Day. Also happening right now is a major food distribution once again at Aloha Stadium. It started at 10 a.m. this morning. Again, you can find more information about the food bank, the resources they provide, and those weekly food donations that they have throughout the week on their website. I encourage you to visit hawaiifoodbank.org for more information on that. And again, we see those long lines continuing today. It'd be interesting to see how long those lines last and if they continue to be just as long as people get back to work and some of those unemployment checks sort of get back out. We know that the backlog is slowly being taken care of, but interesting. We should, we'll try to keep a track on seeing those lines to really gauge how much people in the community continue to need these services. But again, we mahalo the Hawaii Food Bank for all they do to continue to help feed our community.
Yeah, that's every Wednesday and Friday at Aloha Stadium for the month of May. As we told you, Dr. Sarah Park is going to be joining us tomorrow. And then on Friday, Nancy Creedman of the Domestic Violence Action Center is going to be talking to us. We know a lot of families are very stressed right now, and a lot of people are stuck at home, and that can lead to more instances of domestic violence. And there's a lot of issues with whether some cases are being reported specifically about child abuse, because teachers are often the ones who spot abuse in the home. So we're going to be talking to her about all of that. If you or someone you know needs to see this program, we really encourage you to join us on Friday. She's going to be sharing resources about how you can get help if you or someone you know is in a dangerous situation.
That's why a great conversation coming up there. And again, next week, we'll be talking once again to Governor David Ige as the state begins to sort of go through their phases, their color-coded phases of releasing businesses and other things that are happening. We know that requests continue to go in from the counties to the governor's office. Every day, it seems like we're getting an update of a new request for our businesses to open up. So we'll get an update once again, from the governor. We'll also be hearing once again from Scott Murakami, as well as Lieutenant Governor Josh Green, all happening next week. So another full week to look forward to. Again, we want to thank our partners in this, the Hawaii Executive Collaborative and Hawaii Pacific Health, for their efforts in helping us to keep this conversation going. We thank all of you for tuning in and for sticking with us through this time. It's hard to believe we've been doing this almost for 2 months now, and it's really been enlightening and great to see those viewers who continue to tune in. Some of you we see every day who tune in and send in your comments. We appreciate everything. We do read all these comments, so we thank you for taking the time to just be with us and for engaging in this important conversation. So until tomorrow with Dr. Sarah Park and with Yanji, we will see you here 10:30 tomorrow. Aloha.
Aloha.